now live.
Okay, this is Senator Adam Ollier, and I am very grateful to have some real experts and friends and local elected officials here to talk about the number one issue going on, because it permeates everything. So as we look out into the world and we look especially into our neighborhoods and our communities, we all miss our family, right? We miss our parents, we miss our cousins, our aunts, grandparents. And Thanksgiving is typically the time where we all come together, travel all across the country, and some people all across the world, to see the people that we love and do the things that we like to do, which is mostly involving food and sitting around the table and talking stuff. And in too many households, it's all politics. In my household, it's a lot of sadness about football, but that's just because we're Lions fans, and that's the cross we bear, I guess. But this year is going to be a very different Thanksgiving. It's been a very different year. And much of that is because people have been unwilling or unable to find the truth amongst all the misinformation. And so I would be remiss if I didn't mention just briefly, what happened today at the Wayne County Board of Commissioners. That is just another example of how people are letting misinformation and falsities lead our decision making. And in that situation, it's something that, the State Board of Canvassers will handle, some Secretary of State will work through. But it is deadly when we allow our own biases and our own thoughts and the thing that we heard on Facebook or Twitter or saw on Instagram or TikTok or any of these other spaces to guide how we treat a global pandemic that has killed almost 250,000 people in the US, making the US the number one place for deaths and the spread of COVID-19 in a situation where no one would have expected our nation to handle a pandemic so poorly. I am, however, extremely grateful that as a Detroiter in a community that was beset by this virus, we have responded, and we have responded by wearing masks. We have responded by socially distancing. We have responded by listening to people who make sense, people who spent their entire lives preparing for just this moment, and people who did not say, hey, I've been telling you so, be careful, be safe. No, these are people who really care. And so we're joined by two incredible experts and two local officials who are committed to making sure that their residents and their neighbors know what they should be doing and how to be safe. I'm really excited to have my good friend, Dr. Joneigh Khaldun here. You will see her standing next to the governor, like 6 or 7 or 8 feet away from her, all masked up, but answering all of the, all of the tough questions, right? So the governor will say, hey, this is what's going to happen. And then someone will say, well, how does this thing work? And then she'll look to her right and say, Dr. J, can you answer that? Because in this state, science and experts are leading our policy. And that is very different than some states. It's very different than in some communities, but it is the only way we're going to get out of this pandemic. And so I am really, 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 really grateful to have her. I'm excited to introduce her. I'm excited to have Dr. Hammami, who is in a similar role for Wayne County. And Dr. Khaldun is uniquely situated because she used to do this work in Detroit. And so as we look forward into how we're going to handle Thanksgiving and some of those other things and the governor's new pause over the next 3 weeks, I hope that you'll ask the questions that you really want to know, and that you'll take this information, that you'll share it and make sure that people know what they can and should be doing. Because for too long and in too many spaces, people are sending that text message or that Facebook post that says, I heard this from a high-ranking government official, or I saw this on the, don't do that. If Dr. J didn't send it to you, don't spread it. Dr. Fauci didn't send it to you, don't spread it. If your cousin said, hey, this is going to work, don't listen, because the stakes are just too high. And so, Dr. Khaldun, I would love if you would just be able to let us know, really quickly what's going on with COVID-19 in the state, how people should be thinking about this moment, and we'll move to the county, and then we'll go to that kind of moderated Q&A. But I really want people to understand not just what's going on, but the gravity of if we don't make the appropriate changes. Because a month ago, we were talking about how cases were looking good, I guess almost 6 weeks ago. And that was when the governor had a significant amount of authority, was making the right decisions. And as a member of the legislature, I'm extremely disappointed that over the last 45 days, almost 60 days, we have made no effort to follow the science and to take the very basic requirements and steps necessary to protect our friends and neighbors and kids. So, Dr. Chair.
Thank you, Senator. Thank you so much for having me on, and welcome to everyone out there listening. It's really an honor to be here. And again, to be back communicating with the folks in the Detroit area again. It was just an honor to be the Detroit Health Commissioner, and good to see you as well again, Dr. Hammami. So yes, I'm very concerned about what's going on with COVID-19 right now. As you all know well, in the spring, Michigan, the Detroit area in particular, was very hard hit with COVID-19. And especially it really impacted people of color. We worked very hard, and I'm saying we, including the community, local government, hospitals, businesses, and of course, Governor Whitmer and our team at the Department of Health and Human Services to make sure that we did what we needed to do. And we successfully brought that curve down. But you're right, Senator, over the past couple of months, we've seen a significant increase in cases. This is now the dreaded surge that myself and other public health experts across the country have been warning about for some time. And so what we are seeing is that there's a lot of social gatherings going on. There are many outbreaks associated with long-term care facilities, K through 12 schools, restaurants. There are many outbreaks in many different settings. And the bottom line is, we know what's safer when it comes to COVID-19 and its spread. We know that outdoor is safer than indoors. We know that masks work. We know that, I like to say, physical distancing and try to stay away from social distancing, because I do want people to still have that social connection, even if it has to be virtual. But we know those things work. And unfortunately, what's happened is people aren't doing that. Some are, many are, but there's enough who are not. And that is why we are seeing these cases increase exponentially. And so what we're seeing now is, our deaths are increasing. Our hospitals, some of our hospitals across the state are at or over capacity. Even our public health system is becoming overwhelmed. You've heard a lot about contact tracing. Well, now I'm telling my staff and staff at local health departments, you have to prioritize. Everyone may not get a call from a contact tracer, not because we don't want to, it's because we simply don't have the capacity when we're seeing 8,000 new cases a day. So very concerned about what we're seeing now, but I'm also hopeful because we know what works. And what the governor and the director of Health and Human Services put out on Sunday and goes into effect at midnight, I think if we all follow that guidance and do what we're supposed to do, we will start to see this curve come down again.
And Dr. Hammami, you are the kind of lead person in Wayne County as from a medical standpoint. Can you just talk a little bit about what it looks like on the ground in Wayne County? Wayne County being a county that, 6 months ago, people were saying, this is the only place that COVID-19 is really a thing. And now COVID-19 cases and the positivity rate is one of the lowest in the state still, right?
Thank you, Senator. In fact, we are mirroring what the state is seeing, certainly, and other counties. And as Dr. Khaldun mentioned, we saw a dip, and we believe that we were out of the woods, if we want to call it that, especially in Wayne County. And even at the state, unfortunately, we are seeing exactly the same trend. And in fact, just today, our positivity rate was at the highest it could be. We are seeing numbers that we haven't seen even early in the pandemic in April and end of March and April. And I think part of it is we kind of became complacent a little bit. And when we saw that dip, when we had everything that was working, we were practicing face covering and the physical distancing, and we had the restrictions in place. I think people became a little bit also, they're experiencing this, what we call the COVID fatigue, where everybody, and we completely understand that everybody wants this to be over, but what we're seeing more is the cases are more prominent or prevalent in the younger population. So fortunately, we're seeing an inverse between the curve of the positive cases, but also the curve of the number of deaths in Wayne County and even in the state of Michigan. So earlier in the pandemic, we had high cases of high numbers of death, but now these are going down versus how we're seeing the positivity rate and the positive cases increasing. And the median age as well as the mode age, and for those, the statistician in the group, the mode age is where you see the most number of repeated. We are seeing it or fluctuate between the 20 and 22, 25 years of age in the county. And I think this is where the emphasis should be and where the message is that although our youth are not going to be affected as severely by the virus itself, they are the ones that can take it back home to their grandparents or to their parents. They are the ones when, as Dr. Khaldun mentioned, we are seeing outbreaks that are not happening in the schools, but they're happening because a football team decided to party after the football game, or because parents were throwing a mock prom party, or we would see a Halloween party that happened in somebody's basement. And unfortunately, one or two students are going to go back and expose 150 students. And this is where the shutdown was imminent. So we're very happy, and as every health department across the state, we always look to MDHHS and the governor and Dr. Khaldun for the directions. And we're very happy that on Sunday, this directive was taken or put in place, because we know it works, and we know that it's going to drive down our cases. And although personally,
let me kind of stop you
yes.
there. And Dr. Khaldun, I know that in this moment, we've talked a lot about Thanksgiving, and as you talk about events and that kind of space, can you tell everybody how you're going to do Thanksgiving and what people should be doing? Right? So what should people be planning for? How should they be doing this? What is a safe way to do Thanksgiving? And what are you going to do?
So I'll be honest with you. We will not have gatherings this Thanksgiving in my household. Usually, again, most of my family is from Southeast Michigan, various places, mostly in the Detroit area. And every year we usually have at least 3 or 4 households together. This year it's going to be me, my husband, and my children, our household alone. We all live with each other, and that's what we're going to do. It's going to be challenging. We're thinking about doing some fun Zoom calls. We've done a lot of family Zoom calls this year. And actually, I've connected with a lot of my friends that I hadn't even before with these kind of new apps and things that we have. So that's my plan. Really, the safest thing to do is to not gather at all. You never know if you're going to be having the virus. You don't even have symptoms and you have the virus. I know a lot of people talk about testing. So I'm going to get a test and then I'm going to go and go to this gathering. One single test does not give you full security that you actually don't have the virus, right? So a test does not eliminate the need for true prevention. So quarantining, if you really think that you want to have a gathering, again, I recommend against that. And then, of course, mask as well.
So today is the 17th. If you wanted to quarantine, you need to have started that 3 days ago and be getting tested. So just so people, to say on the extreme, if someone were really trying to do this, what would they really need to do to be reasonably safe?
So I'd say there's never 0% risk, right? So when I talk about quarantine, it's 14 days. That's based on the incubation period, if you will, of the virus. Once you get exposed, within how many days do we expect you to show that you have the virus if you're going to get it? And so that period is 14 days. So yes, quarantine, but quarantine means really quarantine. That means not being around other people, quite frankly, even within your household, especially if those people in your household are ever leaving the house. It means not going to the grocery store. It means not going to work. I mean, quarantine, to do it correctly, is a true quarantine. And I know for a lot of folks, that's very difficult. And so again, one test before you travel for the holidays is not sufficient to really know that you don't have the virus, which is why I recommend just not gathering at all.
Just to reiterate, the only safe way is to stay with the people you live with. If you are going to try and do some other thing which is not recommended, which is not in keeping it, the thing that is in keeping with the order is 2 households, 10 people. Is that correct?
That is correct. That is safer. Safest, not 100% safe.
Right.
Safest is not to do it at all. Safer is to just have one other family. And to be honest with you, ideally that family is quarantining before as well, right? So every time you expand your bubble and you're letting other people into your household, whoever they've been in contact with, those people become a risk to you as well. So we recommend that people actually talk about this concept of podding. So what's a pod? So it's really, if you really want to socialize, and I understand that humans need socialization, if you really want to socialize, pick one family and pick one family that is really following the best practices and not potting with another family, for example. And then really stick to it. And still, to be honest with you, you would still want to wear masks and distance as much as possible, even if you choose to have that one other family that you gather with.
Well, I really appreciate that kind of holiday heads up. I'm going to pass the baton to our two moderators. That's Councilwoman Lyons and Councilwoman Sawicki, who are going to moderate the rest of the question and answer period. I just wanted to kind of hit the highlights of those big points. And so, Ernestine, the floor is yours, or the space, or whatever we call a digital world.
Yes, I did want to ask, a really, salient question. And, thank you, Dr. Hammami and, Dr. Khaldun so much for coming and, fielding these questions. It seems that, we have this American diet, and, I think the rest of the world can probably have the same sort of just this dependence on meat. And, it's kind of, we've seen cases where the outbreak is believed to have been, it has its origins in a wet market in Wuhan, China. I used to live in Wuhan. I feel like I've been to that same wet market where there was not a ton of regulation and there were animals stacked on cages. And, so we kind of see the effects of this in not only the coronavirus, but the E. coli 0157 outbreak in 1993, and then SARS. And so it seems that there's a correlation between eating, touching, and infected animals, and animals coming into contact with each other that are sick, and then eventually passing viruses on to human hosts. And it seems like there's just a correlation of this foodborne illnesses and this rise of infectious diseases. Would you recommend that we have stricter animal regulations worldwide to curb sort of this rise of zoonotic diseases, or do we need to really be becoming vegans? And just kind of what is the real correlation between like this rise in infectious diseases and what we're eating?
Shot first. So excellent question, and I think we're still learning about kind of how exactly this virus kind of hopped over into humans. I don't want to speculate about who ate something and all of that. But I think what you're seeing, again, when I was in Detroit, I responded to the largest hepatitis A outbreak in modern history. As you said, there was SARS, even Eastern equine encephalitis. I mean, at the state level, I've been responding to these kind of emerging infectious disease outbreaks in a way over the past several years that we haven't seen before. And I think what you're seeing is, quite frankly, climate change, I think, is part of it. I think there's again, interaction between human beings and animals more and more, and climate change, again, contributes to that. I don't know that I would say necessarily becoming vegan would kind of address that, but I think it's about, again, there's multiple factors. I think there's the interaction between humans and animals. I think there's climate change, and then there's just best practices. Measles outbreaks. We're now responding to measles outbreaks. When I was in medical school, I'd never seen a measles case. We didn't really learn about it, and now we're dealing with that because people aren't vaccinating appropriately. So there's a lot there, but I think it's a very complex issue. Oh, Dr. Hammami.
I certainly wouldn't add any much more, but you are absolutely right, Dr. Khaldun. I think, Councilwoman, again, very great question. What is happening in the global movement and the interaction of ecosystems is what we have been witnessing for the past at least 10 years. Let's take from, as Joneigh mentioned, SARS, then Ebola, for example. Once we started disrupting that balance, then we were forcing species to come into contact with each other in much different ways. So for example, if we look at what is happening in the Amazon forest, which is the home for most of the bats population, and we're depriving bats from their natural resources of food, we are forcing them to start coming to where we are and start coming to urban areas to get that food. And that means we are now exporting or importing zoonotics that we haven't had in the past. Zika, for example, and again, globalization and movement of people and all that have contributed a lot to it. I certainly would say better regulation, better control, but then also addressing, and we always talk about the root cause of the problem. So addressing the root cause of the problem in a much global way, which is not an easy thing to do, especially when you have people that do not believe in climate change. I'm not going to name anybody specifically. People who, countries that are not going to join forces because of any political reason or any differences in combating that. We are still probably, as the United States, in a better shape and a better place. We have regulations, we have inspections, we have that. I think I will be the meat market enemy number one if I say we should all move into becoming vegans. And I love a steak, so I will not do that as well. But again, I think we need to have everything happening all at once in order to minimize that risk.
Thank you for that. And I think it's really more about like, what is the most extreme solution that can help this, combat this rise in diseases. And with that, I'll turn it over to my colleague, Councilwoman Sawicki, for the next question.
Thank you. I know that people today seem to have some trouble understanding that this is still a dangerous virus. I know that we have a number of people, not so many I've heard recently in our community here, but throughout the state, where we're getting this conflicting information about the fact that the virus really isn't dangerous because we have all these treatments and doctors know how to treat it. And, they think of it as being fake news. Can you give us a little information or a little idea about the current danger that people are facing through this virus, the lingering effects of the virus on people? Because just getting over the virus isn't enough. We know that it can have long-lasting and lingering effects on the body. Can you give us a little update on what the medical community can tell us about the true problem of this virus?
Let me give you the philosophical point, and I'll let Dr. Khaldun give you the clinical point. I call us still living in a para-COVID time. We are not post-COVID. Some people call it post-COVID. We are not. The two reasons is, one, well, we have an effective vaccine, but still we do not have the vaccine. People are not getting the vaccine. So we still are not seeing that. Second, we do not have a definite effective treatment. We have treatments that can help, but there is no cure. So when any disease, whether it's COVID or whether it is any other disease you want, if you do not have something to prevent it or something to cure it, then it is dangerous no matter what it is. So that's where I would say that it is a dangerous infection because we still do not know enough about it. We do not have a cure. We are keeping our fingers crossed to have the vaccine. But again, if people are not vaccinated, then that is not going to prevent it. So as long as we don't have those three things in place, then we will not go into a post-COVID world.
And that's right. And I just add, again, I've heard people say it's like the cold or it's like the flu. That's just not accurate. Yes, some people may get the virus and they may get over it, but there are many people who do not, unlike the cold or the flu. Researchers are still learning a lot about long-term, and we don't know how long because we're still in the COVID era, right? But people having long-term challenges with their memory. People, you've heard about inflammation of the heart, myocarditis, so people having that. You've heard of people needing lung transplants. I'm a practicing ER doctor. I'm seeing patients every shift who say, yeah, I thought I beat COVID. I was intubated in April and I got out of the ICU, but I haven't really been able to walk since then, or I've been short of breath since then. And so I'm admitting patients to the hospital again who are still getting over these symptoms. As Dr. Hammami said, there is no vaccine right now. And even the day it becomes available, it's going to be several months before everyone has access to it. And when it comes to treatments, doctors have learned a little bit more about how to treat some of the sickest patients. So things like turning people over on their bellies, we call it proning, giving people oxygen instead of putting them on a ventilator for as long as possible. And there are some other treatments, but they are certainly not curative, as you would see with a lot of other diseases. So it's not the cold, it's not the flu. Death is not the only important outcome. And that's really important for people to understand. Even if you have a mild illness, you don't even have to go to the hospital, you can still have long-term health impacts. So that's really important to know.
Thank you for that. So we talk about like the vaccines and things of that sort, and there is this just the reality is it's going to be a while before that's something that is going to be in the general public, before people are able to really utilize a actual vaccine to make sure that everyone is protected. And so as we wait, and Dr. Hammami used the word para-COVID, we're within it and it's just existing, and we're going to be facing a lot of unknowns considering this is a novel coronavirus. Can we expect to see these strains or mutations of strains result in a superbug or any type of genetic changes in the virus?
It's certainly possible. My lab team in the state has actually been tracking various strains of the virus as it has traveled across the state. So it is certainly something that is possible. And again, I'll just kind of say, when it comes to the vaccine, I know everyone's really anxious and can't wait for the vaccine to be available. I'm one of those people as well. But again, as you said, it's going to be some time before it becomes available. And so prevention is really what we should all be focusing on right now. Those masks, 6 feet of distance at least, outdoor, better than indoor. Those are the things that we have to really be focusing on. I can tell you my team, every day I spend multiple hours working on planning for just distribution of the vaccine when it becomes available. But again, when it becomes available in the beginning, it will only be for a really small subset of people, highest risk healthcare workers, and it'll be several months before the general public has access to the vaccine.
And I think to add to it, certainly having the recent news about the two types of vaccine that are there and the level of effectiveness is something that is the best news we had since the beginning of this pandemic. I think another thing that we should consider, especially as a society, is unfortunately this disease from its beginning, or this pandemic from its beginning, has been so politicized that even a vaccine that is something that we as public health professionals advocate for has been used as a tool, a political tool. I'll give you an example. I teach a class at U of M, Introduction to Public Health. And I literally have 100 students, which makes the calculation of the percentage very easy. I paused a question and I told them, and this was before the news of the vaccine and certainly before the elections, but I told them, if there is a vaccine before November 2nd, how many of you would you take it? And these are not your lay people. These are on their way to become health professionals. They know enough about vaccines and studies that go into that. 95% of my students said, I will not take that vaccine immediately. I'm going to wait at least a year. So that is 95% of who you expect are going to be the first in line to get vaccinated. And unless we regain the trust of the people and the science, and as you said, they're not listening to rumors, they're understanding what is behind that, then we will never reach the herd immunity or what we need to accomplish from the availability of that vaccine. Mind you, again, as Dr. Khaldun mentioned, that vaccine isn't available to be in mass distribution, and it's going to be phased in and all that. So until probably the spring of next year, we probably are still going to be where we are now.
All right, I have a question, and this is going to bring us back to the holidays. China, and I think it was about 2 weeks ago, released some information about, I think it was 14 people who had contracted the virus through frozen packaging food. And I know, I recall being cautioned that the virus is not killed by cold temperatures. So can you advise people what they should be doing when they bring groceries home? Everybody's going to be shopping for Thanksgiving and Christmas. Is there a procedure that should be followed when it comes to bringing groceries into our house, cleaning surfaces in our house? We've heard it before, but I really think that it's a valuable thing to remind people of at this time.
Sure. I think the current data that we have and what's coming out of the CDC is that the primary way that people are getting the virus is through respiratory droplets. So talking, sneezing, laughing, just quite frankly breathing, which is why we have emphasized so much the wearing of masks. It is a potential, but likely very small contributor, which is the surfaces. So of course, going to the grocery store, touching handles and whatnot, that may contribute, but it's probably not the primary way. So what I recommend and what I do in my own personal life, yes, when I go to the grocery store, I'm careful, I'm mindful about opening up the various doors, if you would, to the cold items, but I don't wipe down I don't necessarily wipe down boxes when I get home. I don't think that's really necessary, and it's not what the data is showing us. I do make sure I'm physically distancing when I'm at the grocery store, and I do sanitize my hands when I come in and out of the grocery store and when I'm touching surfaces. But I think that's best practice and what I would recommend for people.
Let me kind of hop in there. Dr. Khaldun, there has been some questions about mask wearing, and I know that has been the big emphasis. Can you talk about if there is any difference in the type of mask aside from wearing an N95 or something? I know there's been a lot of question about those that have a respirator piece where you can breathe out, if that is actually still safe. If you need to have a filter, if it's just a t-shirt or some of those different things. And I know you've talked a little bit about them, but if you could just kind of give people the quick and dirty, that'd be really helpful.
Sure. So when I'm in the ER, when I'm intubating someone, absolutely, I'm wearing an N95 mask. But the general public, for most things that people are doing every day, you don't really need to have that. There are surgical masks that you can find. They're kind of the ones with the blue kind of multiple layer that you will see in the hospital as well. Those are a little bit better those are not as good, if you will, as the N95s, but they're a little bit better than the cloth mask. Really, for the general public, all you really need is a solid cloth mask with a good material, nothing with lace, right? We don't want holes in the mask at all. Multiple layers is best. You want at least 2, if not 3 or 4 cloth layers. We do want you to be able to breathe comfortably through the mask, and there are many on the market right now. You can get them on Amazon. We do not actually recommend the masks that have that little respirator. Oftentimes they have a little circle opening on that. We actually don't recommend that people use those at this time because there's some data showing that they're not actually effective in limiting spread. But the quick and dirty is, for most folks, it's a cloth mask. At least a couple of layers is fine. It protects both you and the person who you may be in contact with from spreading the disease.
Thank you for that, Dr. Khaldun. I also wanted to address, just sort of, looking at not only, Wayne County, District 2, and then my community in Harper Woods, you do have to acknowledge the social determinants of health sort of show that disparities in the African American community have been writ large by the coronavirus pandemic. And so in some ways, when you have these pre-existing kind of, factors that contribute to, African Americans being more at risk and being more susceptible to, catching the virus and possibly spreading it. And, what are some ways that, us as officials or us as policymakers, what can we do to really help make these factors a priority in our world, in our society going forward, to really be able to get us to new heights when we address, these types of disparities.
So let me start with that. This is a great question, and I think it is very important for us to acknowledge that COVID-19 did not cause the disparities; it just exposed the disparities. We knew about them. All of us that work in this space and the health professionals have been talking about the social determinants and inequities and disparities for at least the past 10 years. And maybe that's the positive thing or the silver lining that came out of this pandemic, that now it is a buzzword that you hear in the news and even in amongst politicians. But I think what is important to understand is that unfortunately, sometimes there is no choice for someone to isolate. When the decision is to put food on the table or pay the rent, and you're the essential worker, then no matter how strict the mitigation measures we have, you have to drive that bus. You have to take public transportation. You have to go and work in services, and you have to go and work in food preparation and all that. And it is not a secret that at least 50% of the essential workers are of ethnic minorities and are African Americans. So we are basically putting those at more risk than those of us who have the luxury to be at home. So when we talk about combating disparities and ensuring equity and addressing the social determinants of health, we always use the term, we want to change the system, we want to change the environment, but we also want to change the policy. And this is where legislators are going to be very important in ensuring that we have policies that eliminate disparities. We have policies that ensure equal opportunity for people. So, for example, one simple thing is to put a temporary moratorium on evictions. If you cannot pay your rent, then you should not be homeless just because you're isolated or because you lost your job or because you have to go into quarantine. So these are some of the policies that certainly can help in alleviating the impact of the pandemic on those that are most vulnerable and at risk. Then you have the food insecurities, and then you have the access to healthcare. I lost my job because my company is losing money. I am not an essential worker, that I was laid off. I now don't have access to health insurance, so I don't have access to healthcare. So do I now prioritize that I need to bring food to my family and food to my children, or do I pay my insurance bill or take preventive measures and all that? So this is where a change in the system and putting together policies that protect those that are most vulnerable is going to be very important.
Yeah, I 100% agree with that. I think it's important to note that, when we talk about disparities in health inequities, it has nothing to do with the color of someone's skin. That's not making them more susceptible to the virus. It's about, quite frankly, racism. We have to call it what it is, and racism that has created these policies that perpetuate the inequities that Dr. Hammami is talking about. I can talk a little bit about our state response, and quite frankly, I'm proud that we have actually really eliminated the disparity for African Americans when it comes to COVID-19 cases and deaths in the state compared to the spring. African Americans, 15% of the population. In the spring, 40% of cases, 32% of deaths. And now essentially African Americans make up less than 15% of cases and less than 15% of deaths. Again, that win, if you will, is fragile. We still have work to do, but I'll tell you what we focused on. One, Michigan was one of the first states to say, let's look at our COVID-19 data based on race and ethnicity. I think we were the third state in the country to actually identify that. If you don't look for it, you're not going to find it, and then you can't address it. So my team, I asked them to look at this data in this way, and of course, that's what we found. And then we decided, what are you going to do with the data? We actually targeted our approaches based on that. So we brought together the community, brought together a racial disparities task force. We actually targeted testing based on something called social vulnerability index. But basically, we looked at places that had more communities of color, had more people living in poverty, and we actually targeted testing to those communities. We also targeted our communications. 2/3 of our multi-million-dollar communication effort was actually targeted to communities of color to make sure that they got this important message. And it wasn't about doing things to the community. I don't believe in that. It's about asking the community what they're hearing, what they're feeling. Do they feel like they can't get access to a test? And so I think that is part of why we saw those disparities come down. In addition, supporting people to be able to isolate effectively, free masks for people. Those are the types of things that we worked on. I believe it contributed to us eliminating the disparity for now.
Thank you. I actually didn't know that we had kind of reversed some of these statistics, and that's actually really, really great to hear.
Yeah, wonderful. Question about nursing homes. If we have family members in a nursing home or a care facility, we do have a pretty high senior population, and they are being affected as well. What can we ask? What can we do to ensure that our loved ones are being cared for properly, or how can we best make certain that they're getting, not getting the COVID?
Yeah, we've certainly focused our efforts at the state on our most vulnerable residents living in nursing homes. Michigan and quite frankly, every state in the country has seen that the people who have the highest death rate are those who are elderly. And there's a high percentage of deaths occurring in nursing homes. So we have done a lot on that front, aggressively working on testing. So there's a testing mandate now to make sure we're identifying COVID when it is in the nursing home. We also know that, quite frankly, a lot of it stems from the community. So not necessarily the nursing home patients, but people, staff who are coming in. So we're implementing testing for staff. We're also working on PPE, making sure that the appropriate PPE is present in nursing homes, and doing a lot of technical assistance, working with LARA, so our licensing agency for nursing homes in the state as well. So, but it's incredibly important that we continue to support our most vulnerable residents in nursing homes.
From a local health perspective, we certainly are working with our long-term care facilities and our skilled nursing facilities, and ensuring that they have mitigation plans and they are protecting their residents. So, using a lot of what is working, the distancing, the sanitization, the hygiene. At some point, there were some restriction on visitations. Now the visitations are maybe not as strict, but they have to adhere to certain protocols, who can visit, the number of visitors and all that. And unfortunately, we still see every now and then several cases or a case or two, but again, we're not seeing them in the numbers that we saw them earlier on during the pandemic. And I think this is where our facilities are now more skilled at immediately identifying a case, isolating it in the right time, cleaning, sanitizing. As Joneigh mentioned, the staff that are coming, the repeated testing, the PPE that they're using. So that has dropped tremendously.
Thank you. So what we'll do now is, as we begin to pivot, I'm going to take a few questions from the audience here. Let's see if there are any questions, and there are also a few people online who are also asking questions. Someone asked a question very similar to Councilwoman Sawicki's about, care for, loved ones in hospitals and concerning visiting them. But I do want to address, just.
Can I jump in with a quick question?
Sure.
I had a resident ask me, actually I have two resident questions. One has to do with vitamin D. They had heard that taking vitamin D can help prevent COVID from being as virulent in the body if you should come in contact with the virus. Is that a practice that we should get into? Should we be taking vitamin D? And if so, how much?
You know, I've seen some of that around on the internet. I can say it certainly does not hurt to be healthy right now, to eat a full diet. If you take a multivitamin, I think that's a good idea in general. Again, there is no cure, no proven cure for COVID-19. But what we have seen, however, is that people who have underlying medical conditions, actually there's data about people who are obese, who are more at risk for severe complications from COVID-19. So I would certainly recommend, especially with all of the stress going on right now, both physically and mentally, you know, if you want to take a multivitamin, that's probably a good idea. Getting good exercise is a good idea. And again, just making sure your body is as healthy as possible right now.
The second question, I didn't know if Dr. Hammami wanted to jump in on that one, but the second question I had to do with a resident who was invited to be a cantor at church, and he knows that singing is something that's a little dangerous and not recommended. He would not be singing with other people, but are there precautions that he needs to keep in mind to keep himself and other churchgoers safe?
So I'm not sure I understand the details of it, but certainly if there is going to be a risk of getting close to each other, if there isn't enough barriers between the singers, I assume the question is that they are going to be in the same place performing and singing.
Actually, no, it's a single person singing. So
Okay.
it's just one person will be singing, you know, to their congregation. And so he wasn't certain, you know, if he had to kind of be away from people, any particular distance, you know, just to safe.
That's a tricky one. I don't know, Dr.
That's a tricky one. Yeah, I'd actually say. So actually, based on our current epidemic order that's out, gathering in non-residential indoor areas is not actually allowed under our current order. We have allowed gathering for the purpose of funerals for 25 people and under. But I'd say that really it's not safe to do right now. Certainly if people, I know people, you know, they do what they want to do sometimes, but if you are, the physical distancing is important. The singing, you're right, that increases the risk of spreading the virus even further than if you're just speaking. So wearing a mask, singing with the mask on, if you really, really must do it. But again, I wouldn't recommend that at all at this point in time.
I do want to ask one of the final questions as we begin to wrap up here. So there's another question about the vaccine. It's been really fast tracked, and you know, we're hearing that, you know, we need to restore trust. And can you really address some of the points of, you know, what you've seen as far as making sure that people are confident in the vaccine despite the accelerated development?
I think there has been a level of transparency in both vaccines, how they were conducted, the results were shared with the scientific community that allow that level of trust to know whether there were any adverse effects or any side effects and how the vaccine has been done. I think also knowing that there wasn't any, I mean, the scientific method, how those studies have been done. However, it is a new vaccine, and we won't know what might happen until it is put in practice, and we are going to monitor it for a year or two. But at least the preliminary studies that have been done, and they've been done on a good amount of people. I think 15,000 for the Moderna. I don't remember the Pfizer one, how many, but this is a good size. It's not, as you recall, the early experiments on like the army in Russia or in China that had like 10 or 20 or 60. This is not a very confident, it doesn't give you the intervals of confidence. But overall, again, can you say 100% with certainty that these are going to be safe vaccines? Probably no one can. But so far, based on the results that we are seeing, based on what has been published, based on what has been shared with the scientific community, then they are as effective and as safe as they can be at this point. I don't know, Dr. Khaldun, if you agree or not.
Yeah, that's right. And I'll talk a little bit about the process. So, it takes many, many years normally for a vaccine to come on the market. And so from what I've seen, and working in government as well, understanding that sometimes things take a little longer than they really need to. They basically condense the process, but they're still going through all the same steps they would in a normal process. The fact of the matter is we don't have 15 years to wait for a vaccine. And so there's a way to do this so that it's safe. So once these vaccine manufacturers actually submit their application for, you hear about EUA, so emergency use application. Once they do that, they have a committee of public health medical experts, some of them actually right here in Michigan, who will review all of this scientific data with scrutiny. And then they will make a recommendation as far as whether or not that vaccine moves forward. I trust this committee. It's ACIP. They are the nation global experts in immunizations. And so they will have to approve this vaccine in order for it to move forward. And then when the vaccine is out in the public, there are many things that the government is doing right now to make sure if there are any adverse effects. And again, even for Tylenol, there can be adverse effects. So we do expect some people to have some side effects, but the most important thing is that people were able to track those, were able to understand them, and it's getting back to the government. Just like for any medication or any vaccine, that is the normal process.
I have a quick question, kind of change the subject slightly. But some bars and restaurants, I mean, they're shutting down indoors, they're doing curbside, but some bars and restaurants have talked about setting up outdoor tents with heaters. They call them igloos. I've heard that they're not very safe, but I have a feeling that many people might be drawn to that type of thing. In Michigan, it gets awfully cold. And I think people might feel a sense of safety if they're able to gather outdoors, even in a heated space outdoors. Can you give us some insight as to whether that is truly safe, or what we need to kind of caution ourselves about?
Yeah, so we will have some FAQs going out on our website. We've gotten hundreds of questions about that. But just from a general principles, when we're talking about indoors versus outdoors, we're talking about ventilation. If you are in, whether it's in a brick and mortar building or whether it's a tent or an igloo, if you are in a fully enclosed space where there is not good ventilation and you're with a household outside of your own, then that is a risky thing. And so again, if people can figure out ways to make ventilation good, that's fine, but creating small singular houses, if you will, with multiple people in them are not the safest at this time.
So to kind of put that in perspective, it's like when the thing says, don't inhale these fumes in an enclosed environment. They're not just saying don't outside, they're saying also a tent or anything like that. So like painting fumes, thinking about it in that way would be a better way for people to think about indoors versus outdoors. That kind of, can you smell it? Is it lingering versus is it a brick and mortar location? But
that could be one way. I mean, people are getting very creative. And again, I get it. So I appreciate it. But if there are more sides open to this structure, right, that's going to be safer. It's about ventilation and not being in closed spaces.
Awesome. Well, I think that's all the questions that we have. I really appreciate everyone taking the time out. This is everyone is like, oh, please stop saying unprecedented. Like, we're in uncharted waters. This is a moment where nobody expected us to be in. except people like my dad who have been planning for this moment for literally his entire life. And he's like, you know, that one, like everybody's got a friend who's like, I told you this was coming. It's been coming. I've been reading this book. I told you that's my dad. My dad has been reading every plague, pandemic, public health book for the last forever. And is like,
Him
I
and
bet
Bill
you're glad you
Gates.
had that till now. But so thank you so much for enlightening the rest of us, for taking the time to give us some extra tools, and so that we know what we need to do to be safe during this holiday season and over the next couple of weeks. I know that the decisions that you all have had to make have been extremely difficult, because there's nothing fun about telling grandma that you can't see the kids. And as someone who has a 2-week-old child and a grandma, 2 grandmas and grandparents, and a great grandma who's like, so can we FaceTime? Yeah, grandma, we can FaceTime, you know, like so like, I mean, this is that kind of moment. And so we really appreciate you trying to tell us the things that we need to do safely now, so that the day that we get back to being with the people we love is sooner. And most importantly, that they are still around for this safe space. So thank you so much, Dr. Khaldun, Dr. Hammami, Councilwoman Zwicky, and Councilwoman Lyons, for this, I think, really important moment and taking the time this evening to do this. So we will post all of this information later. And if you have more questions, you can reach out to us, and we will make sure that our good medical professionals get us back any answers or things like that, because in this moment, they have really been committed to making sure good information is out there. And so we are incredibly grateful. So thank you, and have a good evening.
Thank you so much.
Thank you all so much. And you know, it was truly a pleasure to meet you both, Dr. Khaldun and Dr. Hammami. Thank you so much for joining us.
I appreciate it. Thank you. Good to see you all.